class. So basically, yesterday we talked about fluid and electrolytes, acid base. So in that, this diagram is very important here. In that, every electrolytes may be anion, it may be cation. All are given here is very important, I think so. So intracellular fluid in the fluid, in the cell fluid, in the tissue fluid, in the plasma. This is blood mostly, cellular fluid, tissue fluid. Okay. So here sodium is 10%, potassium is more. Here sodium is high outside the cell. In the plasma, it is also high, but potassium is less. Here calcium is less. In intracellular fluid, 1%. Here 3%. Here 5%. Magnesium is high in intracellular fluid, and here 2%, 2%. Chloride is less in cellular fluid, tissue fluid high, plasma high. Has CO3, sodium bicarbonate, you can see here 10%, 30%, 28%. Sulfate 75%, 2%, 2%. SO2 minus 24, 21, 1. Proteins 51 to 60. So this is very important. This diagram will help you to understand how much amount of electrolytes are there. And you can see that this is the diagram. This is also very important. This is the you can see this is the summary of the electrolytes. So how much you can see that we will do blood tests, and that everything is given here. So how much normal amount to be there of electrolytes in the blood. Okay, so already told you a renal function test have blood urea, nitrogen, serum creatinine, sodium, potassium, and chloride levels. Other than that, you have to advise the patient, please check serum calcium level, serum magnesium level. Okay, then you will get the idea of what value is present in his body. So sodium, normal range, this is okay. And what are the functions given here? Potassium, normal range, and function. Calcium is very important. Magnesium is also very important. All electrolytes are very important to us. Okay, so this is the box also. You have to know about that phosphate. Okay. Next is in this box, if the balancing of sodium, potassium, what we will call, if the sodium is less, what is called hyponatremia. If the sodium is high, hypernatremia. If the potassium is low, hypokalemia. If the potassium is high, we will call hyperkalemia. Calcium is high, calcium is low, hypocalcemia. If the calcium is high, we will call hypercalcemia. So these are the terminology for imbalancing of electrolytes. So most of that will be sodium, potassium, and calcium. Okay. So today we will discuss about acid-base balance. So basically, the hydrogen ions, the hydrogen ion are positive side, we will call acid. The hydrogen are in lesser side, we will call base. So we have to maintain the acid-base balance. If the hydrogen ion are more, so what will call? It will call acidosis. If the hydrogen ion less, we will call alkalinosis. But both are harmful for our body. More alkaline is also dangerous. It is like a poison. More acidic, it is like acid, will damage our cells. So we need normal pH levels per hydrogen levels. Okay, that is 7.35 to 7.45. This is the normal pH we need to present in the blood. Okay, so basically we have some systems which maintain this acid-base balance. Okay, some alkalines are there. So if the extra alkalines are there, if the hydrogen is high, so what will do? They will rise and it will balance it. If some acidic nature of present in the blood, so what will do? If alkaline is high, so what will happen? It will balance. So likewise, we have two systems like bicarbonate. Okay, sodium bicarbonate. This is a weak acid. Weak acid means if alkaline is high, so what will happen is this will acidic will balance it. Buffer system means uh, what will I can tell you that to balance the pH. To balance the pH, we have the system that is called buffer system. So over sodium bicarbonate. One is sodium bicarbonate, and another one is phosphate. Another is sodium dihydrogen phosphate. Okay, so this will have the reactions they will do as they to decrease the pH level or increase the pH level, but they will maintain the pH in the body. Okay, so I have the formulas here. I think it will not help us, but it will help, but not now. We'll discuss in detail in biochemistry. Okay, and we have other buffer system. Buffer system means understand it will maintain the pH level. So just sodium bicarbonate, phosphate, and also protein. Protein also helping for buffer system, and we have two mechanisms. This will internally, if this systems also failed, the pH is not maintaining, we will utilize a respiratory mechanism, and another one is renal mechanism. So what will respiratory system will do? Respiratory system will eliminate carbon dioxide. The respiratory system affects pH because it aggregates carbon dioxide present in body fluids. As you know, the respiratory system will cause of a pH imbalance, or may I help correct a pH imbalance from some other cause. So we will call respiratory acidosis. If what happen, if carbon dioxide is more, so what will happen? It will call hydrogen ions are more. So what will cause acidosis? If the hydrogen less and large amount of carbon dioxide is exhaling, what will happen? Hydrogen ions are less. So what will happen? It will cause alkalosis. So we need both to balance. So what will respiratory rates do? It will do opposite work. If carbon dioxide is more, so what will happen? We have more respiration. If we will lose the carbon dioxide more, we will exhale more, more inhale. We will exhale more. Carbon dioxide is released. If the carbon dioxide is less, what will we will inhale more? Because of the inhalation only, oxygen is binding and making carbon dioxide after waste product. So what will it will inhale more. So these are the respiratory efforts to make acid base balance. And we have renal mechanism also in that H plus ions are be released, not reabsorbed in the tubular in the renal tubular, but it will be released. So what will happen? The patient will have burning sensation in the urine. Okay, so that like the body uh, maintain the pH levels. So pH is main important. Okay, because it is like protector of the body. Okay, and to maintain pH level, we need all these systems and mechanism. We have two mechanism: respiratory mechanism and urinary system mechanism. Okay, and systems mechanism, that system is buffer system. In that sodium bicarbonate will help, that is weak acid, phosphate weak base will help us, and along with protein buffer system. So all this will help us to maintain pH level. So I think this is enough for us to understand One thing is that there is the one another term, that is metabolic acidosis. It is also understand, we will need to understand metabolic alkalosis. We already know uh, respiratory alkalosis, respiratory acidosis, renal alkalosis, renal acidosis. If the renal is absorbing more hydrogen ions, we will call it renal acidosis. If the hydrogen ions are more releasing from the water, from the urine, we will call alkalosis, because hydrogen is less. So we need balance. So here one term is used, metabolic. Change in pH caused by other than respiratory order are called metabolic disorders, metabolic acidosis or alkalosis. In either case, the respiratory system may help prevent a drastic change in pH. So basically, other than respiratory system, other than urinary mechanism, so if the alkalosis or acidosis happen, so like we will call it metabolic acidosis. What are the conditions? Like diabetes. In the diabetes, we have metabolic acidosis. In the diarrhea, vomiting, some of the diuretics will cause metabolic acidosis. And metabolic alkalosis is not common. Okay, but overall, we will take, if the more antacid medications, it will call metabolic alkalosis. So this is all about pH. Here we have the diagram will explain metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. So if what are the thing in we will see in the metabolic acidosis, kidney disease, diarrhea, vomiting, or diabetic mellitus. In the alkalosis, overtaking of medications, gastrics, uh, tablets, etc., etc. Acidosis, respiratory acidosis, we will see in emphysema, asthma, pneumonia, paralysis of respiratory muscles. Alkalosis, respiratory anxiety, high altitude will cause respiratory alkalosis. So this is all about, we have study outline to go through, and you have to know those all these things till here. So it will help to summary all those things. So we completed pH level. Now we have the chapter that is very, very important. That is reproductive system. So reproductive system, in the reproductive system, we will talk about male reproductive system and female reproductive system. So now we will discuss about reproductive system. So basically in that we have basic introduction about meiosis, male reproductive system, and female reproductive system. What is reproduction? Reproduction means we are human beings. Okay, so uh, God gave us the ability to form same human like you. So we need a system to work for that process. So like for circulation of the blood, God gave you circulatory system. For respiration, inhalation, exhalation, God gave respiratory system. For digestion, you have digestive system. For urine output, you have to filter the blood. You will get the urine. So God give you the urinary system. So likewise, production of new human, you need those systems to produce same human belongs to you. So there is a need of the system, reproductive system. So why it is necessary? So understood the reproductive system, but why it is necessary? Why it is necessary means this is the world where you welcomes a newborn to see this entire universe. Okay, it is necessary, first thing. And second thing is it is your necessary also to produce a human like you who supports you. Okay, who built you. Okay, so this is also a necessary thing. And most of the things is support you. Because when you have a son of maybe a girl, a boy, so what he will do, he or she do, they will support you, okay, in your work, in your life, in your everything. And at the old age, at the age of after 60s, you need a one support who have who take care you, okay. And second thing is that not only take care, he have respect on you, okay. And fourth thing is that respect, caring, and having emotional attachment. See, this is only possible when he belongs to you. He belongs to you. So this is only possible. Three things: caring and supporting, and third was is emotional attachment. Okay, so emotionally he will attach you. Okay, this will help you to leave your other part of life, that is old age. So at the beginning of their career, means not career, they at the beginning of their age from 0 to 20, they need your support. After 20, they will stand upon their legs. After 30s, you need support from them. And this is the circulation of life. So what will happen? You born, after that your son will born, then you will go to the your destination, with it may be uh, whatever your destination is there, okay. Then he will continue your legacy. So likewise, the reproductive system will help us to maintain this circulation. Okay, so let's talk about here also. The introduction part is given, so directly will come into the topic. Here, basically, not only we have reproductive system, but cells also have reproductive system. Cells also multiply. Cell division will also happen. Okay, cell divisions also happen. So it means that your system is not only is the reproductive system, cells own mechanism is also there, so they will also divide, okay. So likewise you need also divide. So this will tell you that you need to divide, like cell are dividing. So cell dividing process is known as meiosis. What do we call meiosis? So we need two things, that is gametes. We need gametes. We need gametes, that is sperm or egg cells. In meiosis, one cell with the diploid number of chromosomes 46 for humans, divides twice to form four cells, each with the haploid number of chromosomes. Haploid means half the usual diploid number. So for humans, the haploid number is 23. Although the process of meiosis is essentially the same in men and women, there's an important difference. So basically, we have 46 chromosomes, okay, in our cell, in the nucleus, okay, in the nucleus. So from our from men 23, and from women 23 chromosomes will come and they will bind together. So 23 will come from one from one side, 23 will come from another side. So there's uh, some difference are there. Those things are discussed here. We will call this spermatogenesis, oogenesis. Spermatogenesis is a process from the male. Okay. Oogenesis is a process from the female. So these are the two processes which occurs to make a new human. So let's talk about first spermatogenesis. Spermatogenesis is the process of meiosis as it takes place in the testes, the site of sperm production. Within each testis, there are seminiferous tubules that contains spermatogonia, which are stem cells that generate sperm. Spermatogenium divides by mitosis to form two cells, one of which will remain in place as a stem cell, while the other differentiate to become a primary spermatocyte that will undergo meiosis, as you may recall chapter. Okay. Follicular stimulation hormone from the anterior pituitary gland initiates sperm production, and testosterone secreted by the testes when stimulated by the luteinizing hormone from the anterior pituitary gland promotes the maturation of sperm. Also produced by the testes. Decrease the secretion of SHS, as you can see. For each primary spermatocyte, they undergoes meiosis. Four functional sperms are produced. Sperm production begins at puberty, 10 to 14 years of age, and millions of sperm are formed each day in the testes. Although sperm production diminishes with advancing age, there is usually no complete cessation as there is of egg production in women at menopause. So basically, this is the process. Spermatogenesis is here. The complete this diagram explain that. So first, whatever the cell is that is stem cell. So it will produce two cells. That is called one cell for production of same two cells, and one will stored as a stem cell, base cell, and another is spermatogonium. Spermatogonium divides into primary spermatocyte. Primary spermatocytes will produce secondary spermatocyte. Secondary spermatocyte will produce spermatides, and spermatides will produce mature sperm. For this, we need two things. That is, one is FSH hormone and LH hormone. Because if FSH hormone, it will inhibit sperm production. But LH hormone stimulated the testosterone in the testes, which will begin the process of this process. Okay, spermatogenesis. This process is named as spermatogenesis. So FSH inhibits the production of sperm, but LH, luteinizing hormone, you have to produce the sperm cells, okay, in the testes for spermatogenesis process. So which will help? LH hormone will help. FSH hormone will stop the production. Sorry, here one thing. FSH hormone not stop it. It will initiate. Okay, so it will initiate the sperm production. Okay, what FSH do? FSH initiate begins the process of sperm production. But what LH do? LH will mature the sperm. Okay, with that, meiosis will happen easily. Okay, immature sperm cells. Some patient will complain to that the immature sperm cells are more. So what will happen here? LH is not working properly. LH is not releasing by the pituitary gland, and as well as testosterone is not working properly. So both testosterone, LH hormone mature the sperms, and FSH hormone will initiate the sperm production. The process is spermatogenesis. Okay, so basically the sperm production is started at the age of 10 to 14 years. So basically millions of sperm will form each day. Okay, but there is certain age in that the number of counting will be decreased, but some production will happen at the old age also. Okay. Next is oogenesis. Oogenesis is the formation of ovulation. Okay, let's talk about that. Oogenesis. Oogenesis is the process of meiosis of for egg cell formation. It begins in the ovaries and also regulated by the hormones. So here also FSH hormones is working. FSH hormone initiate the growth of ovarian follicles, each of which contains an oogonium. So basically, FSH is releasing from the pituitary gland. Ladies have ovaries. Ovaries will release what will release oogonium, ovarian follicle. Okay, we'll do the process step. That is oogonium. Oogonium, it is also a cell, stem cell, stem cell, beginning of the cell. It also initiate two cells. The name is primary oocyte. It will go again meiosis. It will multiply. But here only one functional egg is produced. The other cells produced are called polar bodies. They have no functional and will simply deteriorate. So here three cells are formed. Two cells are not working, non-functional. One cell is functional. Okay. A mature ovarian follicle actually contains the secondary oocyte. The second meiotic division will take place if and when the egg is fertilized. So here in the process, only you have oocyte, secondary oocyte. But after entering of the sperm into the at the place of fertilization, the egg and the sperm will attach together and will form secondary to then second division of meiotic division. Okay, so this is very important. Here, I think, yeah, you're given that stem cell, oogonium, new stem cell, oogonium to primary oocyte, secondary oocyte. Here, secondary oocyte is only mature ovum. Okay, it is not working. Deteriorate will happen. It will die. Oogonium, mature ovum. So then we have need sperm cell to begin the process of mitosis. The production of ova. Ova begins at puberty and continues until menopause, 45 to 55. When the ovaries atrophy and no longer respond to pituitary hormones, during the 30 to 40 year span, egg production is cyclical, with a mature ova being produced approximately every 28 days. So ova is produced for every 28 days. Actually, several follicles usually begin to develop. We'll discuss in detail in the female reproductive system. Okay, these all are discussed. We'll discuss in detail. Actually, several follicles usually begin to develop during these cycles. However, the rupturing of the first follicle to mature stops the growth of the others. The process of meiosis is like other human process. Is that mistakes may something sometimes. One of these trisomy is discussed. Trisomy and Down syndrome. Okay, these are the things we'll discuss in coming classes. So basically, the oogenesis and spermatogenesis. Spermatogenesis is the process in which sperm is reached to the mature level. Oogenesis is a process when the ova is reached to the ova is nothing but egg cell is reached to the mature level, mature ova. So all will mate together and will form a new cell. Okay, so here we'll discuss first male reproduction, then afterwards female reproduction. So we'll discuss complete male reproduction one day, and we will complete female reproduction one day.